So what is it that makes my approach to managing blood sugar problems like type 2 diabetes so different? Well, it's simple. I evaluate and treat people both metabolically and neurologically. We want to get to the bottom. We're going to leave no stone unturned to get to the bottom of what's causing or contributing to your blood sugar problems. Not everyone will need all the tests we're going to talk about right now, but they can give us great clues as to what's going on with you. Not just your disease, but you. Now, when we look at things, when we look at blood work, we're going to look at functional blood work ranges, not necessarily the lab ranges. And I want to explain what that means. When you have laboratory blood work done, and your doctor gets the information back from the lab, you have ranges that are either you're normal or you have a disease. There's no in between. Those normal ranges are very broad, and actually lab work ranges come from an average of everybody who gets blood work done. Now, let me ask you a question. Who are most of the people who get blood work done? That's right, sick people. Not healthy people, sick people. So these ranges are based on people who are sick, and they're a lot broader than they can be. So what we do is we look at your blood work by looking at functional ranges. Now, with the functional ranges, we have an optimal range. Optimal is where your body's functioning best. It's a little bit narrower than what they call normal in your traditional blood work analysis. We also have the disease ranges when we're talking functional blood work. However, the key is these yellow areas right here. Those are the ranges where your body may not be functioning as well as it should be, but you're not quite in a disease state. And that is the best time to find someone and treat someone before their problem gets more severe. Doesn't mean we can't help you if you are in the more severe range, but these functional ranges let us jump on things, get to work on things before they get bad, and they're much easier to handle. Now, we're also going to do a complete metabolic panel on you. Now, a complete metabolic panel and lipid panel isn't much different than the blood work that your doctor runs when you go for an annual physical. But if you analyze it correctly, if you use the functional ranges, it's going to give us a lot of information on your blood sugar status, how your liver's functioning, and also how your gut is functioning. Now, one of the most important tests we're going to do is called hemoglobin A1C. Hemoglobin A1C gives us an idea of your chronic blood sugar situation. What that means is simply this. Glucose is a very sticky molecule. Sugar is sticky, isn't it? Well, it's also sticky when it's inside your bloodstream. And that glucose sticks to hemoglobin. Hemoglobin is a chemical in your red blood cells. So by measuring the amount of glucose stuck to the hemoglobin in your blood, we get an idea of what's going on with your blood sugar over the past 90 days. Why 90 days? Red blood cells live for 90 days. So that gives us a better idea of what's going on than just a fasting blood glucose. Fasting blood glucose tells us what's been happening over the last 12 hours. Now, we also want to run what's called an adrenal stress index. Now, we said about how the adrenal glands are very important and very closely tied to blood sugar. These can be tested by a simple saliva test. You'll take 4 saliva samples throughout the day. In the morning, around lunchtime, late afternoon, and bedtime. By doing this, it will tell us what your cortisol levels are. High or low cortisol will definitely affect your blood sugar. And it also tells us how the cortisol is affecting your brain. Remember, Alzheimer's is now being called diabetes of the brain, and the adrenal stress index gives us an indirect look at how cortisol is affecting your brain. Now, a CBC with autodifferential. Again, your doctor usually runs these when you go for your physical. But by looking at it with the functional ranges, it's going to give us some clues as to whether you have a low-level infection. Whether that infection is bacterial, viral, it can be parasites. It can also give us suggestions as to whether you're suffering from allergy problems. So it's important for us to do. A thyroid panel. Now, if I was to get into all the ways thyroid could possibly affect your blood sugar, we'd have another 2 hours on this video. But let's just suffice it to say that thyroid affects all the metabolism, all your metabolic functions in the body, including blood sugar. This test will also tell us if you have an autoimmune disease. Autoimmune diseases drive the immune system. They cause inflammation. And if they're not dealt with, you'll never be able to get your blood sugar under control. Now, food sensitivities. Now, if you're sensitive to certain foods, such as gluten, which is found in wheat and many other grains, or soy, dairy, anything like that, every time you eat these foods that you're sensitive to, it's going to send your blood sugar soaring. Food sensitivities overstimulate the immune system. They drive up the blood sugar. They also can cause a breakdown of the intestinal tract. And then your body does not digest and absorb food and glucose as well as it should. That leads to more problems. Now, these problems can be dealt with very easily, but you have to test to know if you have them. We can also do a blood test, or a breath, what we call a breath test for H. pylori. H. pylori is a bacteria found in the stomach, and as an infection it can affect your blood sugar, and it's also the #1 cause of ulcers in the United States. It's easy to handle if you know you have it. We also can do an intestinal permeability test. What this is simple. It tells us if you have what's called leaky gut syndrome. If your intestinal lining is starting to become destroyed, food particles that are larger than normal can get through and be absorbed into the bloodstream. Again, this stirs up the immune system, causes increased inflammation, and causes a rise in your blood sugar. Now, we're also going to do a neurological evaluation on you. And the reason for this is simple. Blood sugar abnormalities can affect the nervous system. Okay? As we said, Alzheimer's is now being called diabetes of the brain. 60 to 70% of the people who have type 2 diabetes have neuropathy, which is a nerve problem. We need to find this out because we need to break the cycle of elevated blood sugar, inflammation, and pain. When your blood sugar is elevated, it's going to cause inflammation. Inflammation contributes to pain. Pain is a form of stress. It's going to make your blood sugar go up. It's a big cycle, and we need to break it. If we just try to deal with the blood sugar, but not the other things, we're going to be much less successful if you have inflammation or pain or neurological problems than if we deal with them along with the blood sugar. So you see, there's many factors that can contribute to blood sugar problems. Many factors that can cause type 2 diabetes and insulin resistance. But if you don't know you have them, how can you handle them? And the only way to know you have them is to test for them. Unfortunately, when most doctors evaluate someone for blood sugar problems, they automatically assume that you're fat and that you're lazy. That it's just because you're eating too much and you're not exercising enough. You have no self-discipline. So what they do is they just say, work on that diet a little bit, join a gym, and here, take this prescription. It'll get your blood sugar under control. Now, it might get your blood sugar under control, but all of these medications that handle blood sugar and the consequences of blood sugar, like high cholesterol and high blood pressure, have side effects. And those side effects quite often make you feel not like you. To be honest, they make you feel crappy. A person suffering with type 2 diabetes slowly and surely marches on a downward spiral of taking medication, feeling lousy, taking more medication, feeling worse, then injecting insulin every day, feeling horrible, then taking even more medication to counter side effects of the medication you're already taking. More and more people have no insurance. For people who do have insurance, with insurance reform happening, no one knows what's going to be covered. Treating diabetes is going to cost $250 billion, that's trillion with a T, every single year in a decade or so, and the government's running out of money. Do you want to risk the chance of having to spend the hundreds of dollars a month to pay for metformin or insulin and all the other medications that go along with blood sugar problems? Or maybe do you want to risk paying the tens of thousands of dollars every year it's going to cost for dialysis if your kidneys fail? Your health is not your insurance company's responsibility. It's not your employer's responsibility. And it's not the government's responsibility. It's yours. But that's the best thing about it. You can do something about it if you choose to. I won't kid you. You're going to have to make some lifestyle changes. They might be small, they might be big. But if you keep doing what you're doing now, eating the way you're doing it now, exercising the way you're exercising now, taking the same medications and thinking the same way you're thinking now, you're going to get the same results as you are now. And you're going to stay on that same downward spiral. Type 2 diabetes, pre-diabetes, insulin resistant, metabolic syndrome. Blood sugar problems are very common and they're very deadly. But they can be dealt with. They can be handled safely in ways that won't make you even sicker. Now, I can't guarantee that I'll be able to help you. As a matter of fact, if I take a look at you and I don't think I can help you, I'm not going to waste your time or your money. I'll let you know. But isn't it worth the time to find out if we can help you? If you can feel better, have more energy, spend more time with your family, spend more time on your hobbies. Plain and simple, if you could enjoy your life more, isn't that what life's all about? Don't settle. If you're suffering from a blood sugar problem, let's figure out a way to get it handled.
We do not accept everyone for care. So that we can find out if you qualify for our care and so you can see if we're a good fit for you, we'd like to offer you 2 free visits. On your first visit, we'll do a review of your case history and a review of your symptoms. Basically, we'll look for clues as to why you might have this problem and also try to find out how it's affecting you now. We'll do a review of your recent blood work if you have it, or make recommendations or possibly a prescription for blood work if you need it. We'll also do a neurological evaluation to find out if your blood sugar situation is affecting your nervous system, and if so, how much and how. After I have a chance to review everything from visit number 1, including your neurological evaluation, your blood work, and also your symptoms and history, on visit number 2 we will sit down. I'll review everything I found with you and what I feel that it means. I'll also tell you whether I'm willing to accept you as a patient or not. At that point, if we do accept you as a patient, I'll give you a recommended action plan, what I feel we need to do to get your condition under control.